High-frequency ultrasound is an innovative and incisionless surgical procedure that offers an alternative treatment for patients with essential tremor and tremor-dominant Parkinson's. Tremor can be such a disabling factor, such a disabling thing for any individual to live with. They don't want to go out in public. They don't want to interact with their friends because they are embarrassed. For some, the currently available treatments are not right for them. And we're excited to have this high-frequency ultrasound treatment as another option to consider. HIFU, or high-intensity focused ultrasound, is a technique in which multiple beams of this high-intensity ultrasound are focused to a target, and in this situation, in the brain, to create a disruption of the brain tissue to treat a number of diseases, specifically tremor and Parkinson's disease.
The really cool thing about the high-intensity focused ultrasound is that it's using sound energy. So there's no need to make an incision or deliver any instruments into the brain. It's just sound energy that passes right through the skull and essentially creates a little lesion in the brain, in the part of the brain that's creating the tremor, thereby treating the tremor.
HIFU is approved to treat essential tremor, which is tremor that is more prominent with action, such as eating or writing, as well as tremor-dominant Parkinson's disease.
We've known for many, many years that there are specific areas within the brain tissue where abnormal firing of the brain drives the tremor. What the ultrasound does is focuses the beams on that location to basically shut down that region or to calm it down significantly so that the abnormal firing abates and we're able to treat the tremor. The outcome following high-frequency ultrasound is an expectation of at least 50% reduction in their tremor. Most individuals are gaining more reduction in that, more on the order of 70%. Anything that brings out a tremor. So for most people, they have their tremor day to day, but if they become ill or tired, they notice that their tremor is worse. For an individual who's undergone one of these procedures, we expect their overall tremor level to go down, but things like illness and fatigue will still make their tremor more obvious.
HIFU is incredibly effective for treating tremor, and it is possible to treat tremor in both hands, though at this point it is not possible to treat both hands simultaneously. We perform one side at a time, and if patients would like a second side treated, then we wait at least 9 months before treating that second side so that we can evaluate for side effects and make sure that it will be safe for them.
We are seeing long-term effects well greater than 5 years in the treatment of tremor. It is difficult to separate out progression of tremor because of the underlying cause of the tremor from treatment effect, but we do expect a long-term impact.
Good candidates for focused ultrasound are adults that are older than 22 years old. They have been living with a tremor and carry a diagnosis of essential tremor or Parkinson's disease. Typically, they will have carried these diagnoses for several years and been very debilitated and limited in their quality of life by that tremor. Patients will also need to undergo first-line therapies such as primidone or propranolol for essential tremor and Sinemet for Parkinson's disease. And if they have failed medical therapy first, then they are a good candidate for focused ultrasound.
The day of the procedure involves the individual coming into a pre-procedural area. Their head is shaved to very clean level to the skin. That is required in order for the ultrasound transduction to happen the most effectively. At that time, we provide intravenous medication to help with some discomfort and prevent nausea, and the patient will have a frame placed on their head. This is used for guidance of the ultrasound beams. That frame then becomes their new best friend for the next short bit, where they would then go into the MRI suite, where a dome with that is filled with cold water will be brought over top of their head and attached to the frame. That is the mechanism through which the ultrasound is conducted in order for the treatment to happen. An MRI is then performed to make sure that we are targeting the precise location where the ultrasound is to be focused. And then a test dose will be given through the ultrasound. So a lower intensity dose of the ultrasound will be sent through the system. That allows us to test the degree of tremor reduction, make sure that we are hitting the precise location, and check for any side effects before we make the permanent lesion. Once we are happy with that test dose, then the permanent lesion will be made. Each one of these sessions of the MRI and the lesioning is only a few minutes. Individuals get to go home right away. So after the procedure is over, we bring them back to the post-procedural area and make sure that they're not experiencing side effects from the pre-sedation or the procedure medications, no nausea, that sort of thing. Remove the frame, get them up and walking, and usually people are headed home within an hour after the procedure.
The most common risks that are associated with this procedure are imbalance and sensory changes, meaning numbness or tingling of the face, arm, or leg. If that does occur, it's very often transient and resolves over the course of weeks to months after the procedure. It's very rare that there are long-term permanent side effects related to this procedure.
The wonderful thing about high-frequency ultrasound is that we see immediate results. Patients are going home from the procedure noticing a much greater stability in their arm movements. We are fortunate at Henry Ford to have 3 specialists who are able to perform this procedure. In addition to myself, Dr. Estathios Kondilis and Dr. Daniga Palo are on our team.
To be considered for high-intensity focused ultrasound treatment, you must have a diagnosis of essential tremor or tremor-dominant Parkinson's disease from your primary care doctor or neurologist. You must also be able to answer yes to the following questions. Are you willing to have your head shaved? Are you able to tolerate lying in an MRI machine for 2 hours? And have you tried at least 2 medications for your condition? If you are not under the care of a neurologist for your ET or PD, our movement disorder specialists are a great place to start. Check out henryford.com/movement disorders.